Good afternoon. Thank you for joining us for Preventing Brain Disease, Risk Factors, and Early Signs and Symptoms of Dementia. My name is Ashley Haas. I'm the Director for Consumer Information at Benjamin Rose Institute on Aging. This session today is being offered as a part of the Administration for Community Living, Alzheimer's Disease Program Initiative Project Expansion of Dementia-Capable Communities within Urban and Rural Settings in Ohio using evidence-based and informed programming. Today's webinar will be recorded. During the webinar, you may submit a question at any time using the Q&A button at the bottom of your screen. We do have staff monitoring the questions in the chat to convey your questions to our presenters and to answer any technical questions that you may have. You can turn on captions by selecting Live Transcript, the button with two C's at the bottom of the screen. We are conducting an evaluation of our dementia education sessions as part of this project. You should have received an email with a link to the pre-session evaluation questionnaire, which also contains further information about the evaluation. If you did not have a chance to complete the pre-session questionnaire, we ask that you please complete it now using the link provided in the chat. By doing so, you are helping others in your community. Your responses and feedback will be used to show the impact of programs like these and to improve the tools and resources provided to individuals living with dementia and the people who support them. I now have the pleasure of introducing our speakers for today's presentation, Donna Barrett and Jennifer Hudak. Donna Barrett has been with the Summit County Public Health Department since 2015, overseeing the management of the health departments. She is a current manager of the Senior and Adult Services Unit. She has over 20 years of program development, implementation, and management experience with a focus on geriatric health and chronic disease. Her clinical experience includes hospice, home care, geriatric assessment, and case management. Jennifer Hudak currently serves the Summit County Board of Developmental Disabilities as a senior manager for the Service and Support Administration Department. She leads the DD Board's Technology and Employment First initiatives. She also leads the partnership with Summit County Combined General Health District in implementing the ACL's Alzheimer's and Dementia Program Initiative. She currently serves as a board member for the Ohio chapter of the Association for People Supporting Employment First, the only national membership organization to support exclusively on inclusive employment and career advancement opportunities for individuals with disabilities. Please join me in welcoming Donna and Jennifer.
Thank you, Ashley. All right, I'm going to get us started. I'm going to be talking to you today about brain health and aging, the basics. This program was developed by the ACL, and the presentation aims to provide a foundation for educating adults and their caregivers about brain health, including ways to promote healthy aging and reduce potential threats to brain health. Aging well depends on your genes, your lifestyle, your life choices, and your environment. Even if you're healthy, changes in memory and learning as you age may include more challenges with multitasking, increased difficulty finding words, and minor decrease in the ability to pay attention. With those changes, it should be noted that at any age, you can still improve your skills, learn new things, create new memories, and improve your vocabulary. Next slide, please. So how do we protect our brain? Adapting healthy habits, staying involved in our community, using preventative services, and managing healthy aging, and reduces potential threats to brain health. So how do we protect our health? We strive to eat healthy, complete and do regular exercise, keep your brain active, stay connected, and get enough sleep. The next slide, please. Healthy eating. Good nutrition is an important part of leading a healthy lifestyle today, tomorrow, and the future. Eating healthy tips include eating or drinking less sugar, salt, and solid fats, making fruits and vegetables and whole grains a major part of your diet, choosing lean meats, fish or poultry, choose low or non-fat dairy, portion control, and drinking adequate fluids. A healthy diet may promote brain health now and in years to come. Next slide, please. Regular exercise. Physical activities is one of the most important things you can do to stay healthy. It reduces the risk for diabetes, heart disease, depression, and stroke. It can help us to prevent falls, and it may improve connections among our brain cells. A tip to note, talk to your healthcare provider to see what activities are best for you. Join programs that teach you to be active and safe. Many exercise routines can be modified to fit individuals' fitness levels. Next slide, please. How do you keep your brain active? Well, a lot of ways to keep your brain active include reading books and magazines, playing games and doing puzzles, take a class, join a club. I have a friend who has early stage dementia, and she always says to me, I'm playing my puzzles. So she's doing things to keep her brain active. And we all should try to do that as well. The next slide, please. Social connections. People who take part in meaningful activities say they feel happier, and we know from studies it may reduce some health risks. Being social and staying connected may include activities such as volunteering or working, join a social club or gathering friends and family, trying programs at local communities. Just a note, there are approximately 1 million adults over the age of 60 who help care for a grandchild. I include that as myself, and it does keep you on your toes and keeps you active. So for those that you do it, good for you. Next slide, please. What are the risks to brain health? They include accidents, and we were talking about this earlier this morning, an accident that may cause a traumatic brain injury, alcohol use, smoking and the related risk factors that come with smoking, some medicines or improper use of medications, and then there are certain health conditions that impact our brain health. Next slide, please. Risk factors include accidents, and accidents can happen at any age. As we get older, the risk of falls and other accidents increases, sometimes because of dementia, sometimes because of our physical issues such as arthritis, maybe losing our vision or our hearing. But these accidents can cause brain injuries, and they increase the risk of you getting a brain injury. So how do we reduce the risk of having an accident that would lead to a brain injury? First, we need to exercise, improve our balance and coordination. We need to wear our safety belts and our helmets. We can take a fall prevention class. And for those folks that are over the age of 60, your local area agency on aging, and there are other programs in the community that offer these evidence-based falls prevention classes at no cost. Make sure your home is safe. Make sure that you have rugs on the floor that have backing so they don't slip. You have rails going up and down your steps. If you need tub bars or grab bars in your shower, make sure you get them installed. Review your medications with your healthcare provider. There are medications that we take, or there may be interactions with medications that can impair our functioning and may cause us to fall or have other issues. Have your vision checked on a regular basis. Get enough sleep. 7 to 8 hours of night of sleep is recommended. I need to just share with everybody that falls are the leading cause of both fatal and non-fatal injuries, and for people over the age of 65. So please, please, please make sure your house and you are safe to prevent yourself from having a fall. Next slide, please. Risk factors such as alcohol. Consuming too much alcohol can affect the way your brain functions. It impairs communication among your brain cells. It causes drowsiness, dizziness, fuzzy memory, and slurred speeches. It has a long-term impact on balance, coordination, memory, emotions, and body temperature. And drinking alcohol and taking medicine is very dangerous. Some health conditions such as heart disease, diabetes can be made worse by the consumption of alcohol. Next slide, please. Risk factors related to smoking and other related risks. Smoking can affect your heart, lungs, and your brain. The benefits of quitting smoking at any age include lowering your risk for heart attacks, stroke, and lung disease, better blood circulation, and not exposing to others to secondhand smoke. And a lot of people don't know this, but something else to consider is air pollution, and making sure we limit ourselves to air pollution that comes from fireplaces, including fireplaces and candles. Candles put off smoke and smells, and sometimes, I don't want to say toxins, but for lack of a better word, I'm going to say toxins that can impact our breathing and can impact our brain. Of course, vehicles in industrial areas, because of pollution, can also affect our breathing. We can quit smoking at any age, and we need to keep in mind that it has many benefits to our health, not just with our brain, but for other chronic conditions. Next slide, please. Risk factors from medicines. Some medicines can affect the way your brain functions. We all need to talk to our healthcare provider about this. We need to let them know about the prescriptions that we take and any over-the-counter interactions or drugs, so that they can look for interactions. We need to be aware if there are any side effects from these medications that we take that can impact our memory and our brain function. And we need to know if there are side effects from medications that can affect our sleep. So it's really, really important that we all have that conversation with our primary care providers. And I don't know if any of you have had that experience, but going to the pharmacist to get medications refilled, sometimes the pharmacist will pull, and I've had this happen to me, pull me aside and have a conversation about, counterindications for different types of medications. So it's really important, if the pharmacist wants to talk to you, that you have those conversations. Next slide, please. Risk factors related to health conditions. There are several health conditions that affect our brain health, and some can be managed. Common conditions that impact our brain health include heart disease, stroke, and high blood pressure, diabetes, and sleep problems. I like to say that how we manage our chronic diseases, such as heart disease, diabetes, hypertension, obesity, are the same ways that we need to manage our brain health. We need to know our numbers. We need to know, what our cholesterol level numbers are, our blood pressure numbers, our A1C, our glucose levels. We need to keep those numbers under control, because it's not only going to help us with those chronic conditions, it's going to help deter any brain health issues we might have in the future. Next slide, please. Heart disease, stroke, and high blood pressure. Heart disease and high blood pressure can lead to stroke and blood vessel changes in your brain. How do we reduce our risk of heart disease and high blood pressure? And I named a couple things just a few minutes ago, but managing our cholesterol, how we eat and exercise can help manage your cholesterol. Your physician may decide that you need a cholesterol medication that will lower your cholesterol, which lowers your risk for having a stroke and for heart blockage. We need to control our blood pressure. Hypertension is sometimes called the silent killer. We may have hypertension, but we're not aware of it. And it can lead to strokes and fatalities. So managing our blood pressure and making sure that we go for a yearly annual physical and wellness exam is really, really important. Making sure that we eat healthy, eat those fruits and vegetables and those lean meats and low-fat dairy. Make sure that we do that. Quit smoking. It's very, very hard for people to quit smoking. I had a family of smokers. I was the only one that was not a smoker. And I've watched many, many people struggle with quitting smoking, but there are resources available to help people quit smoking. So don't be afraid to check those out. Limit your alcohol use. As we saw, it has physiological consequences when you drink too much, but it also affects how your brain works. And again, limit your exposure to air pollution. That's something that we don't always think about when we think about chronic diseases, but that does impact our breathing, which can in fact impact our whole entire health. Next slide, please. Diabetes. Diabetes damages many blood vessels throughout the body, including the brain. The conditions that diabetes may increase risk for include heart attacks and stroke, memory problems, and Alzheimer's disease. A lot of folks who have dementia, some of their risk factors for dementia included having a previous stroke or a heart attack and having diabetes. How do we prevent and control our diabetes? Maintain a nutritious diet, manage our weight through exercise, talk to our healthcare provider who may provide medicine. It's really, really important that if you have diabetes, that you try to maintain that and control those symptoms for whole health. The next slide, please. Sleep problems. Sleep-related difficulties can affect brain health by leading to injuries, which we talked about earlier, cardiovascular issues, which are related to our heart, and memory problems. Common disorders that are related to sleep problems include sleep apnea, and a lot of folks who get and participate in geriatric assessments, sometimes the doctor or even a neurologist may recommend that a person have a sleep study to determine if they have sleep apnea, because there can be signs and symptoms that look like dementia that can be related to sleep issues, and that can be preventable. Insomnia, not getting enough sleep, the inability not to be able to sleep. Narcolepsy, that's where folks, I don't know if anybody knows people, but they tend to just drop off to sleep. And restless leg syndrome. Restless leg syndrome can be painful. It can keep people from getting a good night's sleep. So you want to have conversations with your medical provider about these issues. And you want to also get 7 to 8 hours of sleep each night. Again, talk to your healthcare provider. If you are prescribed a CPAP machine, make sure you use that CPAP machine as prescribed. Again, quit smoking and try some relaxation techniques to help you sleep. The next slide, please. Dementia. Dementia generally involves a buildup of harmful proteins in the brain, the death of brain cells, or loss of connections among them. Some of the known risk factors for dementia include age, genes in some people, head injuries, and stroke. Approaches that show promise in reducing the risk of cognitive decline and dementia, but have not had a lot of testing and still need further testing, include exercise, eating healthy, controlling your blood pressure, diabetes, and heart disease, which I've said before, and cognitive brain training. That's, doing those puzzles, reading, doing those types of things that is going to keep your brain active. There are different types of dementia. Again, Alzheimer's is the most common type of dementia. There's dementia related to vascular disease. There's dementia related to alcohol abuse. There's dementia that's related to Parkinson's disease. There are many, many types of dementia. And we want to be able to control as much of the risk factors of getting brain disease as possible, so that we have a better quality of life. Next slide, please. So where do you start? Well, we can all start by doing one thing at a time. Start with a small step in the right direction. The first thing I like to tell people is if you suspect that you're having any issues with your thinking or your memory, doesn't matter what age you are, you really should have a conversation with your doctor. Bring it up, have the conversation, and let the doctor decide what other kind of testing or screening he or she might want to do. So schedule that appointment. It's very, very important. For people over the age of 65 and those who are on Medicare, one of the things that you can do is every year during your annual wellness checkup, you can ask your doctor to do a cognitive screening that's covered by your insurance through Medicare. So make sure that you do that. Another thing that you can do, again, is have your physician review your medications. I know that every year when I go for my annual checkup, my physician wants me to bring my medications. And actually, every time I go to see the physician, they review my medications to make sure that I'm still taking the same things and that nothing's changed because of another, maybe a specialist who added a new medication has been added to my list. So it's very important to have that conversation. One simple thing to do is add 1 serving of vegetables to your diet every day. I don't know how many of us eat 5 to 6 servings of vegetables and fruits every day. I'm not one of those people, but if I could add 1 a day and then maybe 2 a day, I would do a better for my own health. That would be better for my own health. Start a food or activity journal. The most successful people losing weight I've heard have been people who do a food journal and track their calories and track their activities. The same thing. We want to think about how do we change our behaviors and modify our health so that we can stay healthy, and health includes our brain health. And then another way you can improve your brain health is to be really, really active. Find a community center, join a senior center, do silver sneakers, do some of those activities where you're socializing, you're moving, you're having conversations, you're spending time with people. Socialization is a really, really good activity for keeping our brains active and healthy. Next slide, please. Okay. Well, I kind of flew through that, I think, but hopefully you got the gist of it. Taking care of your brain is just as important as taking care of the rest of your body. Now I'm going to let Jennifer talk to you about Alzheimer's disease in the Down syndrome population. Jennifer?
Thank you, Donna. Great presentation.
Thanks.
All right. So let's review how dementia may impact people diagnosed with intellectual and developmental disabilities. Go ahead and move the slide. All right. Most adults with an intellectual disability live in community settings, either independently or with support from families or with support from service providers. Studies in the United States have shown that adults with an intellectual disability with causes other than Down syndrome have a similar prevalence of dementia and are affected by the same types of dementia. The average onset of dementia symptoms is first seen in the late 60s, and symptoms such as memory loss, disorientation, language difficulties, etc., are similar to those in the general population. When working with people with intellectual and developmental disabilities, it is important to document baseline adult abilities by age 35, including detailed information on the individual's intellectual, social, and behavioral function. Several cognitive tests have been used to evaluate thinking and changes in adults with intellectual disabilities. The NTG Early Detection Screen for Dementia is one such tool. Cognitive tests should never be the only tool used to diagnose dementia. As Donna had mentioned previously, you need to rule out other causes of symptoms, such as thyroid problems, possible depression, grief and loss, chronic ear and sinus infections, or other infections, pain as a symptom, side effects of medication, and sleep apnea. Next slide. Alzheimer's disease is more of a concern for people with Down syndrome than those with other forms of intellectual disability. because of the third or extra copy of chromosome 21. This is because chromosome 21 carries a gene that produces one of the key proteins involved with the changes in the brain caused by Alzheimer's disease. There are also several genes on chromosome 21 involved in the aging process, which may contribute to the increased risk of Alzheimer's disease. However, Alzheimer's disease is not inevitable in people with Down syndrome. Estimates show that Alzheimer's affects about 30% of people with Down syndrome in their 50s. By their 60s, this number comes closer to 50%. Although risk increases with each decade of life, at no point does it come close to reaching 100%. Short-term memory loss is not usually an early sign in individuals with IDD. Instead, watch for changes in day-to-day functions, such as reduced enthusiasm for daily activities, loss of interest in social activities, and changes in personality and behavior. New onset seizure activity is often another hallmark sign. Next slide. There's a lot of words on this page. Hopefully everybody's able to read through these. This slide compares the normal aging of individuals with Down syndrome to individuals with Down syndrome who also have been diagnosed with Alzheimer's. Some early signs and symptoms include withdrawing from social obligations, just don't feel like going and doing things at times, versus real loss of interest in social interactions. There's no joy in visiting family or friends or going to work. Another sign is decreasing ability to problem solve or complete routine tasks. With typical aging and Down syndrome, one may need occasional help, versus diagnosis with Down syndrome and Alzheimer's, much more difficulty concentrating and completing multi-step tasks, even including brushing your teeth. And haven't we had, all of us, all those days when you can't find the right word or that person's name is right on the tip of your tongue? Happens to all of us on occasion. An early sign for someone with Down syndrome and Alzheimer's is that person will have increasing difficulty finding that right word and having trouble keeping up with conversation. Next slide. In the IDD population and for people with Down syndrome, we look at potential changes in mood and personality. In typical aging, we might see that the individual has developed a specific way of doing certain things, and they can become irritable if that routine is disrupted. If the individual has Alzheimer's, you may also see dulled emotions and fluctuating moods. In talking about decreased or poor judgment, typically we might see an individual with IDD making a bad decision once in a while, where with Alzheimer's and Down syndrome, we might see worsening of attention to such things such as personal safety. Regarding memory loss, typically people with Down syndrome sometimes forget names and appointments, but remember them later. People with Alzheimer's could display a decreasing ability to pay attention, forget familiar names, and repeat questions over and over. Next slide. All right. Well, we took the time to review signs and symptoms of Alzheimer's with people with Down syndrome. This is a great visual for those of us who need that visual example of how Alzheimer's impacts the brain. This is a scientific sketch of how the brain changes as a result of dementia. The following video provides examples of the impact of brain changes at a very personal level. Next slide. Lastly, let's watch this video from the Alzheimer's Society.
and I'm going to explain dementia to you in the way that it was explained to me. It's not a scientific explanation, but it should give you some insight into how dementia might affect someone. But remember, dementia affects each person in different ways. First of all, I'd like you to imagine that I'm 80 years old, and there beside me, there's a bookcase that's as tall as I am, and it's filled with books. Each of those books represents a memory, a fact, something that I've learned in the last 80 years. Right by my head would be my most recent memories, maybe what I had for breakfast this morning. By my shoulders, I might have my 60s, maybe my retirement party. By my knees, I'd probably have my 20s, so maybe when I met my partner. And then all the way down by my feet would be my childhood memories, maybe my first day of school. Dementia rocks my bookcase. So as it rocks my bookcase, what do you think is likely to happen to those books? They're going to fall out, aren't they? And which ones do you think are likely to fall out first? The ones at the top. So that might explain why my short-term memory would be affected first. As my dementia progresses, I might find that my most recent memories, that's to say, the books that are highest on my bookcase, being from further down, from earlier in my life. Now, say I've got to the point where all of my top shelves are empty and I'm living in the 1950s. I want you to embrace my reality. I'm going to go into my kitchen today and try and make myself a cup of tea. But remember, I think I'm living in the 1950s. So what's going to be different about my kitchen? You're probably thinking the layout, the appliances. Now remember, I want to make tea. The kettle, right? It's likely to be electric rather than a whistling kettle that you put on the hob. You might see me, when you come around one day, filling up my electric kettle and doing what with it? Putting it on the hob. Now say that you're my loved one, my carer, my friend, and you see me doing this. You might be tempted to say, you cannot make your own tea anymore. It's just too dangerous. But how might that make me feel? I might feel sad, frustrated, like I'm losing my independence, thirsty. Now, as I said, embrace my reality. What could you do differently to help me to make my own tea for longer? You could buy me a whistling kettle. Now, of course, I'm not saying that's going to help everybody at different points in their dementia, but at this point, it would help me. So this just goes to show how embracing my reality can really help me to live well with my dementia. From what you've heard so far, you might think that someone with dementia loses everything. But actually, that's because I've only told you about one part of the brain. I've told you about my factual bookcase. Now, this represents my hippocampus. That's the part of my brain where I manage factual and biographical data, so things like names and faces and dates and numbers. And unfortunately, it's built of really flimsy wood and is not very resistant to dementia, which is why it's going to rock so much. And I'm more likely to lose those books. However, there's another part of my brain that manages my feelings and my emotions. That part of the brain is called the amygdala, and it's much more resistant to dementia. So I'd like you to picture that as a separate bookcase, but that is made of solid oak. So even though it will be rocked, the contents will be safer for longer. Now let me explain to you how the two bookcases work together. Say when I was a child, I had a teacher, so the fact of that teacher is going to go way down by my feet on my factual bookcase. But the way he made me feel, which was inspired and like I could do anything in my life, is going to go on the emotional bookcase. Let me give you some examples of how that might work today when I have dementia. So think again, you're my loved one, my carer, my friend, and you come round and we have a blazing row. We have a really big argument because I've forgotten your name. Now the fact of that argument is going to go on my factual bookcase. What feelings do you think are going to go onto my emotional bookcase? Sadness, anger, frustration. And as you go home, you might think, doesn't matter. She's going to forget that we had the argument and that I shouted at her. And you're right, I probably will. But what's likely to stay with me are those feelings of sadness and anger and frustration with nothing to connect it to. I am going to leave you with a positive example. So I'd like you to picture that you've come to visit me, we've gone out to the seaside, we had an ice cream, we had a brilliant day, and I feel safe and warm and loved. But on the way home, I've forgotten the ice cream and I've forgotten the day out, and you might think, it's just not worth visiting anymore. But look, you've left me with those feelings of happiness and safety and love, and that's what really matters. At Dementia Friends, we want to encourage everybody who knows someone with dementia to continue to visit and spend time with people with dementia and help them to live well. And always remember, there is more to the person than the dementia. Thank you.
All right, well, thank you, Donna and Jennifer. We do have time for a few questions from the audience. Please remember to submit your questions using the Q&A feature or either the chat. Right now, if you could go ahead and submit those questions, we'll get started. So let's see. We do have a question about what adaptations in your environment can you make to help people living with dementia?
Okay, this is Donna. You can keep the environment kind of the same, not make a lot of changes to rooms and space and where things are, because people have some rote memory. And so, they're going to remember where their kitchen is, and they're going to remember where their teapot is, and they're going to remember those kinds of things. So that'll keep them safe. Another thing, again, is when we talk about fall risk, with dementia, there comes changes with vision, and sometimes there's changes in functioning. So making sure that those safety features of having grab bars in the bathroom and a raised toilet seat and no clutter around the person's chair where they're sitting, and if you're going to have throw rugs down, make sure they have a backing so they don't slide, so that the person doesn't fall and get injured. We do see falls in people with dementia as well.
Thank you. Are there any specific resources that you can provide?
For people with dementia?
Yes.
I'm going to assume that. So there are a lot of resources for folks that have dementia. What happens is families wait, and they wait too late to start looking for those things. So we encourage people to be proactive, just like I talked about, getting those early screenings and having those conversations with your doctor. That is a resource. Your primary care doctor is a resource. If you're suspicious or suspect somebody has dementia, have that conversation, have a geriatric assessment. If you want to keep the person in their own home for as long as possible, which is what people want. We all want to stay in the community. There are services that are available for people through the area agencies on aging. There are caregiver support programs, such as Bronca we'll be talking about in a few minutes, the BRIC care consultation program for people with dementias and their caregivers. There are resources through the Alzheimer's Association. So there's just a slew of resources out there. It's just, where do you start? And I always say, start with an aging institution, Benjamin Rose, the area agency on aging. Cleveland, if you're in the Cleveland area, they have a Department of Senior and Adult Services. And in my area, we have Vantage Aging. We have our health department, Senior and Adult Services. So just reach out, 211. Almost every county has 211 where you can reach out to find out some places to get connected to.
I can also say our Summit County Library is a dementia
yes.
inclusive.
Mm-hmm.
A lot of great resources there.
Yep.
And are there any specific resources that you'd like to add, Jennifer, for the IDD population?
Just that, people with developmental disabilities can reach out to our agency to see if they qualify for eligibility for our services. And we have trained staff who are dementia friendly that can help families.
Okay, great. Thank you both so much. We really enjoyed your presentation. As Donna mentioned, we are also going to have our project director, Branka Promedica, tell you briefly about BRI Care Consultation. So it's a care coaching program that's available for families that have been impacted by dementia in various counties in Ohio. And it's available through the Administration for Community Living Project. Branka?
Thank you so much, Ashley, and thank you, Donna and Jennifer, for a very informative webinar. And you see that there are many attendees, and hopefully they really walked away with a few tidbits, not only for themselves, but those professionals that are on the call also to pass along to their clients. So thank you so much for all of that important information. So as Ashley had stated, I'm going to talk a little bit about BRI Care Consultation. This is a program that is delivered by care consultants via telephone or email, and we call it a care coaching program because it really is more of an empowerment program to provide the tools and the education necessary to maybe alleviate some challenges that are going on with persons with dementia, and also provide equal support to those that are caring for them as well. What's great about this project is we were able to adapt portions of it to really hit upon some of those areas that Jennifer had talked about with intellectual and developmental disabilities, and how to best support them in the community, their supports, whether it's family, friends, or some of their other supporters that they have, ensuring that they are living in an optimal lifestyle. So what's nice about this also is it is available at no cost. In a little bit, I'm gonna talk about, where to go for these services, and but I'll get to that a little bit. And it is generously funded by the Administration for Community Living. So next slide, please. So diving a little bit deeper. So essentially, a care consultant is assigned to pretty much on any individual or family from the organizations that are delivering this program. And again, what's nice about this is only one care consultant, so it's not as though families are calling into a number and getting multiple care consultants they're talking to. It's one care consultant that families and individuals get to build a relationship with this person, really get to know them, what their needs are, what their challenges are, and helps them work out things like finding and getting connected to health and community services. So we know that it's challenging to know what different service providers do for the community, for individuals, and the care consultant really helps with breaking that apart a little bit, and educating families on what a specific service is, and eligibility, and what they could do for them. And so this is a great starting point for families to be able to get enrolled in immediately to talk about those issues. Once those issues are identified, also the care consultant helps with prioritizing concerns, with creating a plan that's individualized for them, that's based on some of the areas of need that have been identified in the assessment. And what's nice about this too is it's ongoing. So this care consultation program isn't a one-time phone call, but it's a way to kind of, again, start the conversation, develop an action checklist on next steps for how to make sure that their needs are being met, and then continue to follow up with them, and maybe add more steps that for other issues that may arise throughout the process. So it really helps with addressing the caregiving the situations that may occur over the caregiving journey, and not just one time. This program also helps with communicating with loved ones, family members, friends about care and managing difficult situations. And so that communication piece is really important when maybe some family members don't quite understand what's going on. And by working with the care consultant, knowing how to present things to families and get them on board, and also arrange a family meeting so that the care consultant can serve as a facilitator as well. The program, like I said, continues to stay in touch and make those adjustments as situations change. It helps with assisting with getting other family and friends involved and how they get helped, and also being there for those caregivers to serve as an emotional support when feeling overwhelmed or faced with challenges. Next slide, please. So for those of you on the call that are local to the areas that are presented on the slide here, I'm going to talk about that first. But for those of you that are outside of Ohio, I'll talk a little bit about where the program exists in other parts of Ohio as well. But for this Administration on Community Living grant, these are the organizations that deliver the program. So we have Benjamin Rose Institute on Aging, under the We Care Because You Do name, delivering the program to individuals who do not have an intellectual developmental disability and their caregivers. So that's Cuyahoga, Lake Geauga, Lorain, and Medina counties. And then for Welcome House, this program is delivered for persons with IDD, intellectual and developmental disability, and their caregivers or other supporters. So you have those two numbers here that you can contact. And then also we have the program in Washington County, as well as parts of West Virginia through the O'Neill Center, and then Athens County through United Seniors of Athens County. Other parts of the country do have BRI care consultation and may go by different names. But if you go on Benjamin Rose's website and you just type in BRI care consultation, we have a very nice map that outlines the different parts of the country that do have this program. So it's easy to locate by the map. We have the organization name. Otherwise, feel free to contact this number here for Benjamin Rose Institute on Aging, and we could help connect you to the program where else it might be. But also We Care provides the program nationally as well, though through some stipulation. So it may not be free of charge, but like I said, we'll try to connect you. But anyhow, you have all these organizations here that you can contact. And I think that's it for, do I have one more slide for share? Nope. All right, so I took a little bit longer explaining this program because I had the time. So thank you very much. And like I said, contact us if you have any questions about how BRI care consultation can be of any assistance to you or the families that you serve. Thank you.
Thank you, Bronca. And we want to thank you again for joining us today for Preventing Brain Disease, Risk Factors, and Early Signs and Symptoms of Dementia. A recording of today's session will be made available at our website, www.benrose.org, on the event registration page and in our resource library. We will be offering more webinars like this for community organizations and families impacted by dementia. To stay up to date on upcoming webinars and all events that Benjamin Rose has to offer, such as Dementia Friendly Cleveland Heights Week that will be held May 15th through May 20th at the Lee Road branch of the Cleveland Heights University Heights Public Library, please visit our website. Again, that's www.benrose.org. So in the chat, you will see a link to a post-session questionnaire. You will also be receiving it by email later today. We just ask that you please complete the post-session questionnaire within 1 week following today's session. Your responses and feedback will be used to show the impact of programs like these and to improve the tools and resources provided to individuals living with dementia and the people who support them. Thank you again for joining us, and we hope that you have a great rest of your day.